Now, although the ceasefire in Gaza has been extended, Gaza's health system has collapsed. The UN's World Health Organization is warning that untreated diseases could become more deadly than Israeli bombardment. We can now speak to Tarik Jasarevic, who's the spokesperson at the World Health Organization, joining us from Geneva. Thank you so much for your time. Can you tell us how the WHO came up with, concluded that assessment that more people could die from diseases than bombings in Gaza?
Well, what we have right now is 1.8 million Gazans have been forced to move out of their homes. They are in overcrowded settings. They are lacking clean water. They are lacking food. And also the temperatures are dropping. So all this is making increased risk for different sorts of infectious diseases, for respiratory diseases, for waterborne diseases, for skin diseases. And we have already received information about emergence of some of these conditions, and things will only get worse unless there is improvement in access to clean water and in delivery of health care. Unfortunately, as you have said, the health system is near collapse right now, with 2/3 of hospitals and 2/3 of health centers not being functional any longer. And situation north of Gaza is of a particular concern.
Okay, let's unpack. Let's unpack what you're saying. First, I just want you to elaborate on what you said a moment ago about you already receiving reports from Gaza on the emergence of these diseases.
Well, for example, we have received reports on diarrhea cases, acute diarrhea cases, and these can be particularly dangerous in small children who don't have a strong immunity. And if there is no enough of food, and we have heard from our colleagues from the World Food Programme that there is a serious risk of malnutrition, that would make a problem even bigger. There is also reports of respiratory infections. This is where people are in a crowded area, temperatures are getting lower, and that increases death risk. And also, because people are in crowded settings, there is a risk of lice and other skin diseases because people are in unhygienic conditions. Just to give you the scope of this, there's only one shower for 4,500 people, and there is only one toilet unit for more than 200 people right now in these overcrowded settings. So all this is increasing risk of diseases on top of the injuries due to the bombardment.
Okay, so the warning that the WHO is putting out, that if the health system is not put back on its feet, then this is likely to happen. What needs to be done, in your opinion, right now as a matter of priority to put that health system back on its feet?
Well, first of all, we need unhindered access to Gaza to bring in medical supplies. But medical supplies are not enough. We need fuel. Most of these hospitals and health centers stopped working because of lack of fuel. We need hospitals to be safe, that people can continue working in those hospitals. What we have seen last week in Shifa and other hospitals in the north is a catastrophic, because Shifa was the best hospital in Gaza, and it nearly stopped all of its functions. So we need access, we need fuel, and we need safety for health workers and for patients. And for this, obviously, what we need is a sustained ceasefire. What we are hearing right now is not giving us much of hope, because there is a talk of renewed fighting, and that would bring more misery, more death, more injuries.
All right, we'll leave it there. We thank you so much for joining us from Geneva.